Sudeepta, fantastic tour of Acceleration Physiotherapy here in Sherwood Park. Now let's talk some of the common injuries in cricket, soccer, ice hockey, tennis, Aussie football, rugby. Let's talk sprains. What's the most common injury you see where someone sprains an ankle or a knee?
So we see a lot of sprains, a lot of acute sprains. Ankle, as you said, that's a big one. A lot of people with court sports, volleyball, basketball, they'll roll their ankles. They'll come in to me with a swollen ankle that hurts when they're running, when they're doing kind of sideways movements. I personally, I kind of specialize or have special interest in knees. I've done a lot of work with, ACL injuries, MCLs, any sort of field sport with cutting, pivoting sports. We see a lot of knee sprains as well, and those are actually a big portion of injuries that we treat here at Acceleration Physiotherapy.
So if I sprain my knee playing football or cricket, I'd ice it for the first 24 hours, 48 hours, and how many times would you ice it? Then I'd come to see you after 24 hours. Does that sound about right?
Yeah, that's usually been the case. Early on, if you're quite swollen, quite painful, that's something we can do to kind of manage the pain. But yeah, do come see me within the first kind of 48 hours after you get injured, and I'll be able to do a thorough assessment. Just make sure we can figure out exactly what's going on and tailor a rehab program for you.
Well, I'm old school, so I used to love ultrasound machine. You've kind of gone away a bit from the machines and more in the rehab. Tell me about that.
Yeah, so back in the days, in your 90s, 80s, back then, ultrasounds and other modalities, passive modalities, were a big thing. Nowadays, we've seen with the research that maybe they're not as effective as we used to think. We're moving more towards exercise-based, hands-on physiotherapy. We still have those machines available here. We can use them for pain management from time to time, but for the most part, we use our lovely gym space here and the private treatment rooms to do more hands-on and exercise-based physiotherapy.
Right, so as soon as you can, you're basically trying to strengthen that strain and then build it up back to maximum strength, correct?
Exactly, yeah. We see a lot of our athletes here, and they need to go back to their maximum level of function. So that's kind of what we try to achieve here.